The following program contains information regarding medical conditions relating to physical pain and disorders which cause pain. While it is possible to use this information as a self-assessment tool, this presentation is not to be used as a substitute for medical diagnosis or treatment. In the case of any pain, the viewer is encouraged to immediately seek the attention of a physician in order to consider the possibility of serious illness.
One morning I woke up in excruciating pain. I couldn't move my head in any direction, and I really didn't know what to do.
I was standing perfectly still in a store, waiting at the counter, when all of a sudden, my entire right leg, from thigh to toes, felt like it went to sleep on me.
I was doing squats one day at the gym, and I heard a pop in the lower part of my back, and I woke up the next morning and I was in agony.
I was walking with some friends. We hit an ice patch, and I slipped. And I tried to catch myself, and I remember it was really a wrenching feeling. And I kind of heard a sound, and all of a sudden I couldn't get up. I mean, I didn't fall, but my friends tilted me to a car, and I was just paralyzed. And I was screaming in pain. I was taken home. I took a cab home, and it hurt for about a week.
I was walking down the street, and I all of a sudden had a serious pain in my leg, which was shooting down from the lower buttocks down the back of my leg, and it was making it very difficult for me to walk.
The pain continued to progress for that whole entire day into the next day, when I woke up and then I couldn't even lift my head up off my chest.
I thought that it would just recover, as like when the blood starts circulating, but it didn't really recover, and as I walked home with some discomfort, then I found that I had a dropped foot, which I never experienced before. And the person I was with, because sometimes I joke around, they said, "Stop fooling around." I said, "I am not fooling around. I cannot control my foot." And that became frightening.
The most agony I've ever experienced in my entire life. I basically was, I couldn't move, and when I attempted to walk, I was really hunched over and kind of limping in a way that I had never before.
The pain devastated my life. It was with me from the moment I woke up in the morning, the pain until the moment I went to bed at night. I had excruciating headaches. I had to stay in bed a lot. I didn't live my normal life like I used to run, and I couldn't go to social functions with my friends.
It's intense, it's nagging, it's frightening, it's debilitating, moves around sometimes, and creates a desperation because it stops you from not only doing your livelihood, but having fun.
I remember studying long nights, and occasionally I would get zapped in the middle of a study session, and I would be walking across campus and just have to stop in my tracks.
It was about 9 months in duration, where I was severely restricted in what I could do. I'd get up in the morning and wouldn't know how long I'd be up before I'd be crawling back into bed again.
I tried everything for that pain to go away, and soon enough I was able to walk around with a hobble, with a limp, and it would not go away, and it stayed around for a year. And that's how this chronic pain turned into something which was really debilitating.
So I went to see a doctor, and he told me to go for an MRI. The MRI was shocking because they found 2 herniated discs and 1 bulging disc in my neck.
I gradually got worse and worse to the point that I had almost constant, like a feeling of dragginess in the bottom of my leg, like tingling in my feet. And it just progressed and got worse and worse to the point that I went to neurologists and to other physicians, even saw a neurological surgeon who I was sent to, and was ultimately diagnosed with stenosis and prescribed to have surgery.
They took an MRI, and sure enough, there's a bulge. There's a herniated disc, L4, L5, L5, S1.
I was diagnosed with, muscle spasms. I did rupture a disc at one point, spinal stenosis, scoliosis, all the normal things that orthopedists tell you when they look at x-rays and MRIs.
Several people really told me I needed surgery. They said there was really no other way. And if I wanted the pain to go away, I had to have an operation.
I was told I had a herniated disc and that surgery would be my best option. I decided to have the surgery, and it really didn't help. I was still in tremendous pain. Then I was told that scar tissue had formed following the surgery and that was the cause of my pain.
I tried physical therapy. I tried acupuncture. I tried oral steroids, steroid injections. I tried everything until I remembered about a book that I had read or that I had leafed through in a bookstore many, many months ago. And this book was a thin little book by a man named Dr. Jon Sano, and it said something about a connection between the mind and the back pain.
I think I heard about him on the Rosie O'Donnell show. Someone who worked for her had gone to him because she couldn't walk. She had incurable tendinitis, supposedly, in her ankles. And I watched that show, and I thought, I wonder who this guy is.
A friend of mine happened to mention Dr. Sano. And then I bought his books about a month later. And that was the best thing I could have done for myself and for my back and for the pain.
A friend of mine went to Dr. Sarno about a month before, and he told me that he'd pay for the bill if it didn't work. And I said, well, just pay for it now because I can't work. I mean, I've done everything. How is this guy, by just going to a lecture, going to do anything? I mean, it was hopeless. I was already on all kinds of medication, anti-inflammatory, painkillers, and it stopped working. And I just thought it was ridiculous. But I had nowhere else to go.
Dr. Jon E. Sarno, a graduate of the College of Physicians and Surgeons of Columbia University, is professor of clinical rehabilitation medicine at New York University School of Medicine and attending physician at the Rusk Institute of Rehabilitation Medicine of New York University Medical Center.
Since 1973, I have focused my research and clinical practice on mind-body disorders, most particularly a condition that appears to be responsible for the majority of common back, neck, arm, and leg pain complaints. I've written 3 books on the subject and treated thousands of people with chronic, severe, often disabling pain. Lectures are the cornerstone of my treatment program, and since both my lectures and books have helped large numbers of people to become pain-free, it was concluded that a video presentation of my lectures would be of great value to viewers. That is the purpose of this video and the program you are about to see. I hope that it will help you to become pain-free. Welcome. Let's begin this by talking about why we're all here. Why are you here?
Dr. Sano, I've had severe pain in my lower back, which shoots down to my left leg and makes my left foot numb for the last 7 years. I've had an MRI and it shows that I have 2 herniated discs and 1 ruptured disc. The pain is terrible. It consumes my life. I can't play with my children. I've been told I need surgery. I've read your book and I feel a little bit better now. Can you help me with this?
Mm-hmm.
Dr. Sarno, I've had bad lower back pain for about a year now, and the pain went into my legs. And I did take an MRI, and they said I had 2 bulging discs. I've tried physical therapy. I've had 3 epidurals. I can't remember all the different types of doctors I've been to, and I'm still in a great deal of pain.
Dr. Sano, I've had a intermittent pain on my right side, a sciatic pain, over the past several years. And more recently, while I was doing just a mundane activity, I was getting out of a car, matter of fact, and I felt a sharp pain and my back went out and I was incapacitated for a few days. I then learned about your book, which I read, and after reading the book, the pain subsided. So I'm here to find out more about what you have to say.
About a year ago, Dr. Sano, I was doing some strenuous exercising and stretching to where I actually could touch my chest to the floor, and one day I just heard a pop. And after that, it was just a series of excruciating pain that would come and go. I, too, have been through a lot of different treatments. I've been told I had scoliosis. I've been told I had herniated disc. I've been told I had fused facets, an extra facet. And I just came here to hope that this treatment could work.
I had had a lot of pain for many years and just lived with it. And then one morning I was in the shower and I also heard a pop, and I was down and out and I was paralyzed for 30 days. And when I got well, I went and had an MRI, and they said I had severe arthritis of the spine, and did treatments to live with it. And then for years it went in and out, and was well. I was well sometime and then bad again. And then recently I had like a very bad month, and a friend of mine told me about your books, which I had read and thought, well, I have arthritis of the spine, so it didn't apply to me. But then I started to read it and see that I was on every single page in the book, and said I needed to come and see you.
Dr. Sano, about 10 years ago, I started having back pain. I would have episodes that would come and then they would go. About 5 years ago, I had an MRI done, and it revealed a herniated disc, a transitional vertebra, and degenerative disc disease. Since then, I've been in chronic pain, and it's basically consumed my life pretty much. And after having tried many, many therapies, been told I should have surgery, I shouldn't have surgery, I just have nowhere else to go than right here.
Well, it's clear that you're all suffering from some very significant and important pain in some part of your body, and I'm here to help you get rid of that pain. You've all been diagnosed with a variety of abnormalities and other conditions, disc problems, for example, arthritis of the spine, fibromyalgia, and you've been told that these things are the cause of your pain. Well, we're going to talk about that. However, after spending decades studying these problems and also treating large numbers of patients with these problems, I've come up with a different diagnosis. There's something else that's causing your pain. We call it the tension myositis syndrome, TMS for short. I'm here to teach. You're here to learn. We've adopted this learning or teaching method of treatment because we've found over the years that people will get better if they learn what is actually going on. That is the true cause of the pain. That's undoubtedly why large numbers of people have been able to get better simply by reading one of my books. So this presentation is treatment, developing awareness and understanding our treatments. Before we begin, a word of caution. Pain can have many causes, and it's essential that before one assumes that the disorder we're going to be describing here is the cause of your pain, that one will have been studied and examined by one's doctor, and anything really serious like cancer and so on has been ruled out. I assume that in all of your cases here that is the case. So let's begin. The first section is going to be on the physical manifestations of this disorder. That is, what is the nature of this physical process that's going on in your body that's causing the pain, rather than the many other diagnoses that you mentioned before. We call this disorder the tension myositis syndrome, TMS for short, and I'll be using that term to make it easier as we go along. Actually, if I were putting a name on this today, it would probably be somewhat different, because tension does apply to the psychological factors, not muscle tension, but myo does refer to muscle, and itis represents a change of state. So it was obvious when we first started working with this that muscle was the primary tissue involved, and indeed it was the muscles of the neck, the shoulders, the back, and the buttocks, all collectively known as postural muscles. As we went along, however, through the years, it became obvious, and your histories make this very clear, that a variety of spinal nerves can be involved, which means you might get pain down your leg or down your arm, indeed almost anywhere in your back or chest. And then even later, we realized that a number of tendons, any tendon literally, in your arms or legs could be involved. So we were dealing with a very, very different animal than one just involving muscle, which we thought at the beginning. And that's why we use the term syndrome. The word syndrome in medicine refers to any disorder that has multiple manifestations. And by gum, if any disorder warranted that, it's TMS, because with TMS you can have pain virtually anywhere from the top of your head down to the tip of your toes. This slide has to do with the physical process that's involved in TMS. There is a physical process. This pain is real. It's not in your imagination just because it emanates. It's induced by something going on in the brain. And what's involved is that emotions in the unconscious, and we'll talk a lot about rage later on, produces abnormal activity in the autonomic nervous system. Now, I have to tell you a word about what that system is. It's the one that controls all involuntary functions in the body. And it's at work 24 hours a day, whether you're asleep or awake. That means that most of the time it's serving you well, but there can arise occasions, as in this one, in which there's abnormal activity. In this case, it results in reduced blood flow to the involved parts of your body, wherever your pain happens to be, the buttock, the neck, the shoulders, the arm, and so on. The result of this reduced blood flow is that we have mild oxygen deprivation, and I want to emphasize the mild because it's probably only 4 or 5% off normal. The result of that, however, is that it produces pain in a variety of circumstances. The muscles may be involved or painful. If a nerve is involved, like the sciatic nerve, then you're going to get pain down your leg somewhere. You may also have numbness, tingling feelings, weakness, actual muscle weakness, or the loss of a reflex. These are very common, and this is extremely unfortunate because in general, when an individual has weakness in some muscle and there happens to be a herniated disc involved, it will be invariably blamed. That is, the weakness will be blamed on the herniated disc. But as I said, this is extremely common with TMS. And then finally, tendons that are oxygen deprived can also be painful, and this is can be a very severe problem as well.
Dr. Sarno, let me see if I understand this. Repressed emotions cause changes in the nervous system. That reduces the blood flow, and that results in reduced oxygen. That's the source of the pain?
Yes, and of course what makes it difficult to understand at this point is why this happens as a result of an emotional phenomenon, but it does, and of course we're going to be getting into that in great detail in a little while. Yes, it's just exactly as you said. It starts out with a situation involving feelings in the unconscious, and we end up with pain in various tissues.
But what about my bulging discs? I've been told that my discs are causing the problem.
Yeah, well, that's exactly what I was just saying. And of course, the problem is there's not been an alternative diagnosis around for doctors to consider. And so if a person has pain somewhere in the vicinity of a disc abnormality, well, then they are very liable to attribute the pain to that disc abnormality. The fact of the matter is, however, that a bulge, anatomically, would be almost impossible for it to cause pain. We'll talk more about that later.
Dr. Sarno, you're saying that the cause of the pain is emotional. Are you saying that the pain is in my head and that it's imaginary?
No, the emotions don't cause the pain. They initiate the process that causes the pain. And that is in your head indeed, but the process is in your body. It's real. And of course, it's a great misconception to say that the pain is in your head. All right, we're going to look at the 3 types of tissue that may be involved in this disorder. First, muscle, and then nerve, and then tendon. Let's start with the muscles. TMS tends to involve only muscles in the back, the neck, the shoulders, the low back. It does not involve arm muscles, for example, or leg muscles. We can't see the leg down here. And it can actually occur anywhere. However, there are 3 areas that are most important in this syndrome, and that is the buttock area here, and then the so-called small of the back, and then the shoulders. Remember that the pain of TMS can involve any muscle, however, But the commonest areas are down here. Perhaps 60 to 65% of patients will have the problem in this area, and that includes the small of the back as well, and about 20 to 25% here, and then the rest of them are scattered throughout the rest of the back. The one thing that's important to note here, however, and this made a great impression on me when I realized this many years ago, is that no matter where your pain is in these muscles, there are certain muscles that will hurt when we press on them. And I'm referring to an area here, here, in the small of the back here on both sides, and in the top of the shoulders. Now, why that's important is that, for example, someone would come in with pain and they'd say it'd be involving this area. Why in the world would they have pain when we press on the muscles here and here and here and up here? The answer, of course, is that this disorder was originating in the brain. It's the brain that sets up this situation the way it does. And it is not, as we've been saying and will say over and over again, the result of some local pathology.
I've had severe pain in my leg along with my back pain. Are those muscles involved too?
Pain in your leg. Generally, as I said, the muscles in the leg are not involved with TMS, but pain in the leg usually means that a nerve has been involved, and that's very common, or a tendon. So it depends exactly on where the pain is. The second type of tissue which may be involved is nerve, and this can be extremely important. What you see here is that any of the spinal nerves from the neck down through the thorax and the lumbar area. You can see the beginnings of the sciatic nerve here, and we'll go into greater detail about that in a moment, and the brachial plexus up here.
Dr. Sano? I've had tingling down my leg, and I really found it to be quite frightening. I mean, who knows what it could be? The doctors couldn't find anything wrong.
That's a very common symptom. Actually, it is fairly frightening, but it usually means that the nerve that's involved is very mildly involved. But this is very common with TMS. It means that the brain has, there's been mild oxygen deprivation to the nerve that feeds that part of your leg. Now here we see in much greater detail the sciatic nerve is formed by branches from 5 spinal nerves, sacral 2, sacral 1, lumbar 5, lumbar 4, lumbar 3. That means that if your brain decides to involve this area and these spinal nerves and or the sciatic nerve, you're going to have symptoms down your leg. Pain, numbness, tingling, weakness, the loss of a reflex. If the higher spinal nerves are involved, those that do not feed into the sciatic nerve, then you may get symptoms in the upper front part of the thigh, and indeed some patients have symptoms in the groin area. If we go even higher, and these are involved much less commonly than the lower ones, then you may get pain across the abdomen or further up, pain across the chest. Here we see the 5 spinal nerves that contribute branches to make up the brachial plexus. Brachial plexus up there in the shoulders are not like the sciatic nerve down in the leg. All of the nerve function is going through here down into the arm and hand. So if these spinal nerves are involved or the brachial plexus is involved, and I'm inclined to think in most cases where the pain is in the neck and shoulder and arm and hand, it is the brachial plexus that's involved rather than the spinal nerve. However, very, very commonly, when people have pain in the neck, shoulder, and arm, and their x-ray shows a spur in the spine here, the pain will be attributed to that spur, and the patient will be told that they have a pinched nerve. That's a very, very common diagnosis.
Dr. Sano, I was told that I had a pinched nerve, and that was the cause of the pain in my arm. Are you saying that that wasn't?
Yeah, well, that's precisely the point. Actually, it would, I think, be very difficult for a spur in that area to cause any trouble because the foramen, the hole through which the nerve passes, is usually large enough and so that it's got to be almost totally obliterated to cause the pain. Now, as I said before, the problem is that in the absence of an alternative diagnosis, usually what will be done is that the pain will be blamed on some obvious structural abnormality, and that's what happens with the pinched nerve. Now, these are nerves. This is a disc, and that's what the purpose of this illustration is, to talk to you a little bit about discs. Unfortunately, we must, because it's an extremely common diagnosis, that is, various abnormalities of the discs, which often leads to surgery, as you well know. The disc is placed by nature between two vertebral bodies in order to take up the shock. It also allows for twisting to occur. Unfortunately, in certain areas, as in the middle of the neck and the lower end of the back, the discs tend to wear out, and when they do, then you may have this thick material inside the disc. It's a little bit like toothpaste pushing its way out. When that happens, you get a bulge. Now, as I said before, bulges rarely, because of their location, can cause any problem. However, this may then give way, and then this material comes out, and indeed it may come out and even surround the nerve that's nearby. Now, the point is this: that is uniformly believed to be the cause of pain. But in the many, many patients that I've treated with this disorder over the years, I have found that in the majority of cases, the herniated material is innocent. It is not causing the problem. Instead, there is TMS going on involving that nerve or involving the muscles above it.
I was diagnosed with bulging discs, and they said that that was the source of the pain. So you are saying that that is not what is causing the pain?
No, as a matter of fact, in the next visual you'll see some very strong evidence. As I said, personally I don't see how it could possibly cause the pain. This gives direct reference to what you're asking about. This group of doctors under Maureen Jensen published a paper in 1994 in the New England Journal of Medicine, one of our most prestigious medical journals. They did MRIs, magnetic resonance imaging, on 98 people with no history of back pain. And you can see that only 36% of these people had never had back pain. Only 36% had normal discs. The rest of them had bulges at one or more level, or they had protrusion, or they had actual extrusion. Now, I have had many, many patients with extruded, not just protruded disc material, and it turned out that this was not the cause of the pain. Now, this is very, very important information because it indicates that these problems involving, or these abnormalities, let's put it that way, because they're not really problems, involving the discs are really part of the normal aging process. But you know, this aging process starts when you're in your teens, believe it or not. Most radiologists do not expect to see a normal disc space between the fifth lumbar vertebra and the sacrum down at the end of the spine. And that's because these changes are a little bit like, some people have said, like gray hairs of the spine. In other words, it's part of the normal aging process.
Dr. Sano, I had surgery for a herniated disc which was pressing on my sciatic nerve. The surgery didn't help. I still have pain in my lower back and down the back of my right leg. It's very frustrating. Now they tell me that the disc material that was removed has been replaced by scar tissue, which presses on the nerve and causes pain. Is that true?
Well, the scar tissue is undoubtedly there, but in my experience, it's totally benign. The chances are that you're having your continuing pain because you've got TMS, not because of the scar tissue. You know, that's brought up from time to time, and I usually say to patients, just think of the millions and millions of people that have had chest and abdominal surgery for a variety of things. Do they ever get pain because of scar tissue? Enough said. Now, the purpose of this is to talk about the various tendons that may be involved. Remember, now we've talked about muscles, we've just finished talking about nerves, and now we talk about tendons. This, again, is a very common part of this syndrome, and it's important for you to know all of these things, because if in the future you should ever get some kind of a recurrence, for example, pain around the knees, you want to be able to say, well, maybe that's TMS, I better call up the doctor and find out. There are many tendons around the knee, and this is one of the popular spots for TMS to occur. The pain may be blamed on something called chondromalacia, which is a roughening of the underside of the kneecap, the patella. It may actually be blamed on a minor tear of the meniscus, that is the cartilage in the knee joint. These tears are apparently very common, and sometimes they're big. In that case, something needs to be done because that usually will interfere with the movement of the knee. But in most people, they're minor, and therefore one must be aware of the fact that the pain of TMS may be blamed on such a thing. You can have involvement of the tendons at the top of the foot. You can have involvement of tendons of the shoulder here. It's very common there. Again, they're blamed on something called bursitis, or more recent years, since the MRI has come in, more commonly the pain will be blamed on what's known as a rotator cuff tear, and some of those come to surgery as well. So it's very important to know. Now, this is the site of a modern epidemic known as carpal tunnel syndrome. No one in this group apparently is suffering from that disorder, but we want to talk about things of that sort because epidemics characterize what happens when people get mind-body disorders, which TMS is, and when they're not recognized by the medical profession for what they are, when instead the blame is attributed to some structural abnormality or something of that sort.
Dr. Sano, my father's had bursitis of the shoulder for the past several years. Are you saying that this is TMS?
Very likely, because there's no reason. Actually, the bursitis diagnosis is made nearly as frequently as it used to be. Now, more often, they will attribute the pain to a rotator cuff tear. But yes, it's very likely that your father's pain is due to TMS of the tendons. You can see lots of tendinous structures attaching to the bone there.
Dr. Sano, a few years ago I had severe pain in my knee, and I was told I had a torn meniscus. I was afraid to have surgery, and eventually the pain went away.
Well, that's a perfect example of what I said a moment ago. You know, it's interesting. The brain will often choose the site of TMS where it knows something is going on. Now, that sounds weird, but probably that's one of the reasons why people get so much low back pain, because of the disc abnormalities there. And indeed, rotator cuffs do tear, but apparently it's not painful at all, and it's fairly common in elderly people. And so one must be very suspicious that an elderly person complaining of shoulder pain and is told that it's rotator cuff tear, that this is, again, probably an example of TMS. A very, very important subject here. It has to do with when you have the pain, that is both in terms of time and also under what circumstances. And what I've found over the years is that what determines these is not the physical problem of TMS, but actually how you have become programmed, or to use the technical term, conditioned a la Pavlov. And look at some of these common ones, sitting, and what could be more benign than sitting, and yet many, many patients will complain, patients who have low back pain, that the sitting brings it on or makes it worse. Standing in one place, walking, of course, although it's very interesting, depending on how you're programmed, some people will say, if I have problems doing these, I feel better when I walk. And then the next patient will say, walking brings on the pain almost immediately so that I have to sit down. Now, these patients may have exactly the same situation in virtually the same place. These are things that will bring it on. In some patients, they tend to have more pain during the day than at night. Some patients will tell you that the pain gets worse as the day goes on, and others will tell you the very opposite, that it gets better as the day goes on. Mind you, we're talking about essentially the same problem. And there are dozens of other patterns. Why is this so important? Because you must not think, if this is your pattern, that sitting is bad for your back, or standing in one place is bad for your back. It's essential for you to know that's only the way you have become programmed. Conditioning, to give you the idea, you all, I'm sure, have heard of Pavlov's famous experiments where he would present his dogs with food and then ring a bell at the same time, and he got them programmed to expect the presentation of food with the ringing of the bell. Well, after a while, of course, he would ring the bell, not present food, but the dogs would begin to salivate. Well, now what you must understand is that sitting may be your bell, or walking, or a certain time of the day or night. And that's important so that you don't think that this is something that you've got to get over, some physical problem you've got to get over. All you have to do is understand that this is what you've got and go through the therapeutic process here, and you will become deprogrammed, deconditioned.
I play tennis hard and I have no pain. Yet when I bend over to pick up a laundry basket, I get pain in my lower back, and I was wondering why. Is this what you're talking about?
This is exactly what I'm talking about. The tennis is not the bell for you, but picking up a laundry basket is the bell. I had a patient once who did heavy labor all day long. He owned his own truck, and he would load and unload and deliver, and he never had pain when he did that. He only had pain when he leaned over the sink to shave in the morning. That's how he was programmed. Yes.
Dr. Sarno, I could sit in my car and drive for hours and I'm fine. But as soon as I'm at my desk for more than 20 minutes, I have to get up and walk around or lie down. Is this what you mean by conditioning?
One could almost wonder if it wasn't your job that you didn't like.
I like my job.
But that, you do like your job.
I do like my
yes,
job.
that's a perfect example of conditioning, exactly. Now, another very important clinical characteristic of this disorder has to do with what's going on at the moment that the pain begins. Most people with this, I'm sure all of you have had the experience of having episodes of pain. In other words, you'll have an attack and then you'll get better, probably not entirely better, but considerably better, and then a few months later you'll have another acute attack. And it's these acute episodes that we're referring to now. This pain can come on, the pain of TMS can come on gradually, but in many cases the person is doing something, lifting something or carrying something, playing a sport. Many patients, you mentioned tennis, will say that I reached for this difficult shot and I suddenly got this pain in my back. Or performing some sort of exercise routine or lifting weights. Very often minor injuries. The brain will take advantage of the situation and start up the process. The point is that you must know that these things are triggers, that they are not the cause of the pain. That's a very important distinction. What do we mean by trigger? It means that your brain was ready to start this process up. And remember, as you're going to see, the process has to do with psychological things rather than physical things. And the brain is actually very clever about this because it wants you very much to associate your symptoms with something physical. I hurt myself. There's something wrong with my back. I hurt myself doing one of these things. And that's why this is a logical time for it perhaps to start the process up when you happen to be doing something physical. And the other thing that I should mention with reference to this is that people often talk about injuries, old injuries, and they'll refer back to something that happened maybe 5 or 10 years ago and think that every time they get a recurrent attack of pain now, it's because of that old injury. And once more, it's important for you to know that the body tends to heal itself thoroughly, completely, that we have wonderful mechanisms for healing, and there's no such thing as recurrent pain from an old injury.
Dr. Sano, a number of years ago, I know I overexerted myself by picking up a box that was too heavy for me to pick up, and I've had pain since. Are you telling me that I didn't hurt or injure my muscles?
I'm saying exactly that. That was your trigger. In fact, you say you've had pain ever since. If you had hurt yourself, you probably would, the pain would be gone in a few days, and that would be the end of it. There's a very important principle involved here, however. People often think that it's dangerous to lift up weights, it's dangerous to lift things, and so on. If you can lift something, and if you are a weightlifter and it's a very heavy weight, it means it's not dangerous for you. You can't hurt your back in any way. If you can't lift it, it's too heavy for you. If you can lift it, it's not too heavy for you. But this is a very common misconception, that you can hurt the muscles in your back from lifting. What happened was that that's when your TMS began.
Dr. Sarno, there must be some weight that's too heavy to pick up. Can I hurt myself by lifting or picking up something that's too heavy for me?
If you can lift it up, it's not too heavy, as I just said. All right, we've completed the first section now. We've talked about the physical manifestations, and let me remind you once more that the pain of TMS is real, it's physical. When we come back, we're going to go into the question of who gets TMS.
At first, it just was so radical to think that the pain was not coming from my discs in my neck, and everybody, physical therapists, everybody had told me that's where it was coming from. So for someone to say that's not at all where it is coming from, it was shocking to me.
When Dr. Sano told me that the herniated disc was not the cause of my pain, and that the scar tissue following surgery was also not the cause of my pain, I was actually relieved. He said it was TMS, and I had hoped then that the pain could actually go away.
I believed Dr. Sarno when he said the arthritis was not the cause of my pain, because when he said that if it was, I would be in pain constantly. And I thought that that was absolutely right. Why does the pain come and go? Sometimes it would even go from the right side to the left side.
When I was told by Dr. Sano that I had TMS, it was like being told you won an award. I really had tremendous confidence in him. And when I heard his diagnosis, I knew that I was going to be okay.
I can't say that I was totally surprised. The thing that really blew me away was that he had a method for helping you deal with it. Once you recognized and you accepted that that's where the pain was coming from, he had an actual plan to help you rid yourself of it.
The pain was always at its worst when I was sitting behind the wheel of my car driving. The fact that I'm prone to road rage probably has a lot to do with that.
I had to stop believing in all the things that they told me that I shouldn't do, like sitting in chairs that were not good for my posture.
I was scared to bend, I was scared to move, I was scared to lift, I was scared to stretch, I was supposed to sit and stand. I mean, everything was programmed fear.
I was totally programmed. When Dr. Sarno referred to these things, I found myself in many of them. Particularly for me, one of them lifting of heavy objects. You know, everyone had told me, don't lift this and don't lift that, or you might cause further damage to yourself. So I refrained from doing all of those things.
It was extremely hard to put aside all the doctors and all the literature that told me this was a physical problem. But it was a challenge that I was ready to accept for one simple reason: nothing else was working.
All right, now we're going to take up the very important subject of who gets TMS. Unfortunately, it tends to occur very widely and goes under many different names. This is the reality, and I make no apologies for it, although certainly I'm very often asked by doctors how this disorder can involve so many different parts of the body. Most low back and leg pain, and as I said before, that probably 60 to 65% of people who get this get it into low back. Most pain involving the upper back, the neck, the shoulders, and then radiating down into the arm. The whiplash syndrome, and we'll have occasion to speak more about that in a little while because that's a very important subject. And most of the common tendinitises, we've said here ankle, knee, wrist, elbow, shoulder. I've seen this in virtually any and all of the tendons in the arms and legs.
Dr. Sarno, my sister had to quit playing the piano because every time she sat down to play, she would get incredible pain in her right wrist to the point where it became unbearable. And she was told that she had tendinitis, but she never got this pain when she did other activities. Could this have been TMS?
Yes, very likely, and that's a perfect example, incidentally, of programming. In other words, she was programmed to have the pain only when she sat down at the piano for whatever reason. But that's a very, very good example of a TMS tendinitis. Now, other disorders that appear to be part of this syndrome, this TMD stands for temporomandibular dysfunction. It used to be known as TMJ, and that might be more familiar to a lot of you, temporomandibular joint syndrome. It refers to pain in the face, and I've found that many of my patients who come in for other reasons will give a history of having had that, and indeed when you palpate the jaw musculature here, they still have a little bit of tenderness in that area. So that's a very common manifestation. Something called a piriformis syndrome, which refers to pain in the buttock area, blamed on a muscle that's in there, and actually I find this to be a no diagnosis as far as I'm concerned. The carpal tunnel syndrome, we'll also have more to say about that, which involves the wrist and produces symptoms in the palm of the hand. Repetitive stress injury, of which carpal tunnel syndrome is one of the manifestations, but there are many others. We'll talk more about that. Fibromyalgia, which is a painful disorder, is very much part of TMS, but it happens to represent a more severe manifestation of TMS with pain in many different locations rather than located in one or the other, as with most people who have this. And also there appear to be emotional factors associated with this. Very often people with fibromyalgia will have sleep disturbances, anxiety, depression. This is a real problem because this is of epidemic proportions in the United States today. It tends to occur in women more than men. Actually, the ratio is about 10 to 1. And it is an enormous public health problem because the patients are informed that the cause of this disorder is not known, and they have to learn to live with it. Myofascial pain, that's a thing that's been around for a long time, refers primarily to pain somewhere in the back area here. And then post-polio syndrome, which is extremely interesting. One sees this in people who have had polio with residual involvement, usually